Hi there, my name is Jeff. What's your name?
I'm Jessica.
Hi, Jessica. I'm going to be giving you a physical assessment on you, okay?
Okay.
First, can I get what your weight is?
135.
135. Okay, next I'm going to take your vitals, okay?
Okay.
Can I see your arm? And do the blood pressure, which will take your blood pressure and it will take your pulse. Okay? And then while we're doing that, I'm going to take a look at your respiration rate. So just breathe normally, okay? Okay, it's been 1 minute. Blood pressure is normal. Your respiration rate's good. And so is your pulse. Next, I'm going to take a look at your hands and nails. Can you hold out your hands for me? Finger, everything's looking pretty good. Can you move your fingers for me, each of them? Put them down, and then open. Perfect. And then I'm also going to check the color and pigmentation of them. And this color looks normal for ethnicity. I'm going to check for the temperature on both hands. It's nice and warm. No moisture noted. The texture is smooth. I'm going to check the skin trigger. It responds back. And I don't see any lesions or anything on the arms. Okay. Next, I'm going to check your scalp and your cranium. Can you lean on forward for me? And look at your hair, checking the scalp and the whole cranium. Okay. Now look at me straight forward. Now we're going to assess for symmetry. If you can smile for me, perfect. Very symmetrical. Next, I'm going to feel for your temporal arteries. Okay, and I'm going to touch your temporal mandible joint. Can you open and close? Perfect. I'm going to touch your maxillary sinuses. Any pressure? Now I'm going to feel the frontal sinuses. Any pressure noted? Excellent. Okay. Now I'm going to test your visual fields, okay?
Okay.
I'm going to cover one eye. Let me know when you see my hand, okay?
Yep. Yep.
Okay. I'm going to test the other eye. You know when you see my hand?
Mhm. Yep. Yep.
Perfect. Now I'm going to test your cranial muscles, okay? Take a look at the light and I want you to follow it, okay? Perfect. Now I'm going to test your coronal light reflex, okay? Take a look at me straight. Perfect. Next I'm going to test your coronal position. I did that already. Next I'm going to check the external structures of the eye and see if they're intact. I'm going to look at your conjunctiva. Perfect. Now I'm going to take a look at your pupils. Look straight at me. Perfect. And once again. Excellent. Okay, now I'm going to take a look at both of your ears, okay? So put your head a little bit this way. Checking the external structures. Any tenderness noted?
No.
Okay. Now I'm going to do for the other one. If you look that way. Okay. Now I'm going to do the voice test, okay? I'm going to whisper something in this ear. Well, what I want you to do is take your finger in your other ear and wiggle it around and then repeat the words that I'm saying, okay?
Red.
Correct.
Cup. Pizza.
Perfect. Now I'm going to check again with the other ones. If you want to do the same thing.
Apple. Green. Scale.
Perfect. Okay. No tenderness was noted. Next, we're going to take a look at the nose, okay? We're going to view the external structures. The nose is nice and symmetrical. We're going to check the pansy nostrils, okay? Take a deep breath in and out. We're going to try the other one. They both seem about equal. Okay. Next, we're going to check the lips and the buccal mucosa. Can you first open up your mouth? Okay. And purse your lips. Perfect. Okay. Next, we're going to check the trachea. Nice and symmetrical. After that, we're going to check the range of motion. You move your head from side to side, left and your right. I'm going to check the muscle strength. So once you push against my hand. Perfect. Perfect. Okay. And can you go back and forth? Excellent. And then we're going to check the carotid pulse, okay? So left feel. Okay, stop. And then the second one. Okay. Excellent. Now I'm going to have you face this way. We're going to take a look at your chest. We're going to take a look at the thoracic cage for the skin characteristics. The skin looks nice and normal. We're going to check for the symmetry while expanding. Take a deep breath in, and out, in, and out, in, and out. Okay? And then I'm going to have you say the word 99. And keep on saying that over and over again. Perfect. And then we're going to check for costovertebral angle tenderness. Okay? Let me know if this hurts at all, okay? We're going to test it over both the kidneys. Yep. We're going to take a listen to your breath sounds, checking all of the quadrants. Okay, take a deep breath in. Okay. Perfect. Now I'm going to percuss the lung field, okay? Okay. Now I'm going to check for any lumps or tenderness, okay? Let me know if there's any lumps or tenderness on this. Okay. Perfect. I'm going to have you lay down a little bit. I'm going to check your hip. Okay. Now, actually, can you sit on up? Perfect. I'm going to check the front for respiration, for symmetry. Can you take a breath in? And out. Perfect. So much for eyes, and the skin looks normal. I'm going to have you check the tactile perimeter skin and for any lumps at the same time, too. Can I just say 99 again? Okay. Perfect. I'm going to take a listen to the breath sounds. Okay. Now lean on forward. I'm going to take a deep breath in. I'm going to listen to your heart sounds. Take a deep breath in. Perfect. Okay. I'm going to have you lay on back. Okay. I'm going to check for apical pulse. I'm going to take the rate and the rhythm. Now we're going to set the heart. We're going to take a look for any precordium trills. Okay, perfect. You can sit back on up. We're gonna check the range of motion of your arms. Can you raise them on up? And then back down, and then out to the sides and up. Perfect. And then I'm gonna check the upper tropial nose. I'm gonna raise that one up. Okay. Okay. Perfect. Now I'm gonna check. I'm gonna lay on back down. Okay. I'm going to take a look at the jugular veins and notice any distension. One moment. Then I'm going to feel the jugular veins for the pulse. Okay. Now for this next one, I'm going to have you lay it down. You're going to assess your abdomen. You'll lay on the back. Okay, I'm going to assess looking at the abdomen, look at the shape and the contour, and just take a look at the skin and the umbilicus. Everything looks okay. Next, I'm going to let's go for vowel sounds in all four quadrants. Okay. After this, I'm going to percuss your abdomen. Okay, next I'm going to percuss to feel the liver span on the left-hand side, or on the right-hand side. Okay, liver noted. I'm going to do the same thing on the opposite side of the spleen, the calculator. Okay. After this, I'm going to do light and deep palpations to help the organs of the body. I'm going to do deep palpations. Okay. I'm going to have you sit back on that. Now I'm going to assess your lower extremities. We're going to take a look at skin and characteristics. Let's put this. Skin looks normal, hair is evenly distributed. Color is normal for ethnicity. The skin is dry, and for moisture and temperature. Now I'm going to take a look at the pulses, okay? I'm going to do the top heel pulses first. Post-tibial. And then dorsopialis. I'm going to check for any edema noted in the post-tibial. And I'm going to check the toes, each of them individually for any cuts or lesions in between. Okay, I'm going to have you bend your toes on backwards and then forwards. Okay. Then when I have you lean on back, we're going to check the frontal pulse. Then for the frontal pulse on both sides. Perfect. And then checking for inguinal nose. Okay. Perfect. Okay. Okay. I'm going to check the sensation on a couple of your body parts, okay? I want you to let me know if it's dull or it's sharp. So take a look. This feels what it is when it's dull. And this is when it's sharp, okay? We'll check the feet first. Open your eyes. Okay.
Roll.
Okay. Now we're gonna check on your arm. Hand. And then on the face. Perfect. Okay. We're gonna check another test. We're gonna check the stereognosis test. I'm gonna have you close your eyes. I'm gonna put something in your hand, and you're gonna have to tell me what it is. Okay? So. Yeah. Perfect. Okay. And then we're gonna have you open up your eyes. Now what I want you to do is close your eyes and take your fingers and try to touch your nose. Both of them. 1, 2. Perfect. I'm gonna have you lean on back. And what I want you to do is I want you to be able to raise your heel on one foot and to raise it up on the shin of your other one and move it up. Perfect. And do it exactly with the other one. Perfect. Okay. Next we're going to test your reflexes, okay? So first I'm going to check is a brachial. I don't have a hammer, so we'll use my finger as one. So we'll use a pen as one. Okay, perfect. I'm going to check on this side. Okay. I'm going to check back here for the triceps. The other tricep. Okay. Over this one down. And we're going to check. I'm going to check the brachial. Perfect. And then we're going to check for Babinski's reflex. Okay. Fourth bottom of the heel. Perfect. Okay. Next, I'm going to have you stand up. I'm going to have you stand over here. I'm going to have you walk across the room on your tippy toes and then walk back on your heels. Perfect. And then walk back on your heels. Perfect. After this, I'm going to test one more time. Can you just close your eyes and stand still? Perfect. Okay. We're going to sit back on here. Okay. I'm going to test the lower extremity strength. Okay. You push against my nose. Perfect. And push inwards. Excellent. Next after that, I'm going to stand back on it. We're going to do 3 more tests, okay? We're almost done. The first one we're going to have you do is a shallow knee bend. I want you to bend on each knee just a little bit, okay? Perfect. After that, we're going to touch your toes. Perfect. And now we're going to test the range of motion of your spine. I'm going to stand behind you so I can assess. And then I want you to lean forward, and then backwards, and then from side to side. Perfect. And that should do it then, Jessica. Everything looks like it works out well. Now, if you have any questions or any things, you need to follow up with your primary provider as needed, okay? So you should be able to come back in 6 months to a year.